Did you know that as we age, our bodies go through natural changes that can make us more prone to certain health conditions? But here's the good news: you can take control of your health and age gracefully with the right knowledge and habits. In today's video, we'll discuss 6 common old age sicknesses and simple yet effective ways to manage them for a healthier, happier life. So, whether you're a senior or caring for an elderly loved one, stay with us till the end. Before we begin, make sure to subscribe to our channel and hit the notification bell so you don't miss out on more health tips for older adults. Now, let's dive in. 1. Arthritis and joint pain. Why it happens. As we age, the protective cartilage in our joints begins to wear down. This leads to increased friction between bones, causing pain, stiffness, swelling, and reduced mobility. Osteoarthritis, the most common form, develops when cartilage deteriorates over time. Rheumatoid arthritis, on the other hand, is an autoimmune condition where the immune system attacks the joints. Other factors like genetics, previous joint injuries, and obesity can also contribute to arthritis. How to manage it. Stay physically active. Low-impact exercises like walking, swimming, cycling, and yoga can help strengthen muscles around the joints and improve flexibility. Engaging in gentle stretching routines daily can reduce stiffness and enhance mobility. Strength training using light weights or resistance bands can support joint function by strengthening surrounding muscles. Eat an anti-inflammatory diet. Certain foods help reduce joint inflammation and improve mobility. Turmeric contains curcumin, a natural compound with anti-inflammatory properties. Ginger has been found to relieve pain and stiffness in arthritis patients. Omega-3 fatty acids from fish like salmon, sardines, and mackerel help lower inflammation. Leafy greens, nuts, and berries provide antioxidants that combat joint damage. Maintain a healthy weight. Extra weight puts more pressure on weight-bearing joints like the knees, hips, and lower back, worsening arthritis pain. Losing even 5 to 10% of body weight can significantly reduce joint stress and improve mobility. Eating whole, nutrient-dense foods and engaging in regular physical activity can help with weight management. Try gentle stretching and physical therapy. Working with a physical therapist can improve joint flexibility, strength, and movement. Tai Chi and water-based therapy are excellent low-impact activities that help ease arthritis symptoms. Using assistive devices like braces, shoe inserts, or ergonomic chairs can reduce joint strain. Use heat and cold therapy. Applying a warm compress or heating pad can relax stiff muscles and increase blood flow. Cold packs help reduce swelling and numb pain in inflamed joints. Alternating between heat and cold therapy can provide maximum relief. Consider supplements, with doctor's approval. Glucosamine and chondroitin are popular supplements that may support joint health. Vitamin D and calcium help maintain bone and joint strength. Collagen supplements may improve joint elasticity and reduce stiffness. Adopt joint-friendly daily habits. Avoid sitting or standing in one position for long periods. Keep moving throughout the day. Use ergonomic furniture that supports your joints and posture. Engage in low-impact hobbies like gardening, swimming, or light dancing to stay active without excessive strain. Arthritis doesn't have to take control of your life. With proper exercise, a balanced diet, and simple lifestyle adjustments, you can effectively manage joint pain and continue living an active, fulfilling life. 2. High blood pressure, hypertension. Why it happens. As we age, our blood vessels naturally lose elasticity, making it harder for blood to flow smoothly through them. This increased resistance leads to high blood pressure, hypertension, a condition that affects millions of older adults worldwide. Other contributing factors include poor diet, lack of physical activity, stress, obesity, and genetics. Uncontrolled high blood pressure can increase the risk of heart disease, stroke, kidney problems, and vision loss, making it essential to manage. How to manage it. Eat a low-sodium diet. Sodium, salt, causes the body to retain water, increasing blood volume and pressure on the arteries. Cut down on processed and packaged foods like canned soups, chips, frozen meals, and fast food, which often contain high amounts of sodium. Opt for fresh, whole foods like vegetables, fruits, lean proteins, and whole grains. Use herbs and spices like garlic, basil, oregano, and turmeric to flavor meals instead of salt. The Dash, dietary approaches to stop hypertension. Diet is an excellent choice, emphasizing nutrient-dense foods that support heart health. Stay physically active. Regular exercise strengthens the heart, allowing it to pump blood more efficiently, reducing pressure on the arteries. Engage in at least 30 minutes of moderate exercise daily, such as walking, swimming, cycling, or Tai Chi. Strength training with light weights or resistance bands can improve circulation and overall cardiovascular health. Simple activities like gardening, dancing, or stretching can also help keep blood pressure in check. Reduce stress. Chronic stress releases hormones like cortisol, which can raise blood pressure over time. Practice deep breathing exercises, meditation, or progressive muscle relaxation to calm the nervous system. Engage in stress-reducing hobbies like reading, painting, listening to music, or spending time in nature. Social interactions and support from family and friends can help lower stress and boost emotional well-being. Monitor blood pressure regularly. Check your blood pressure at home using a reliable monitor to track changes over time. Keep a blood pressure journal and note any fluctuations or unusual readings. Visit your doctor regularly to adjust medications or lifestyle strategies as needed. Limit caffeine and alcohol. Excessive caffeine can temporarily spike blood pressure, so consider switching to decaf coffee or herbal teas. Alcohol should be consumed in moderation, no more than 1 drink per day for older adults. Get enough sleep. Poor sleep can increase stress levels and raise blood pressure over time. Aim for 7 to 9 hours of quality sleep each night. Create a relaxing bedtime routine, avoid screen time before bed, and keep your room dark and quiet. Maintain a healthy weight. Carrying excess weight, especially around the abdomen, puts additional strain on the heart and blood vessels. Losing even 5 to 10% of body weight can have a significant impact on lowering blood pressure. Focus on a balanced diet with portion control and engage in daily movement. Managing high blood pressure doesn't have to be complicated. With the right diet, exercise, stress management, and regular checkups, you can keep your heart healthy and strong. 3. Diabetes in old age. Why it happens. As we age, the body's ability to process sugar efficiently slows down. The pancreas may produce less insulin, or the body may develop insulin resistance, meaning cells don't respond well to insulin, causing sugar to build up in the bloodstream. This leads to type 2 diabetes, which is more common in older adults. Contributing factors include poor diet, lack of physical activity, obesity, genetics, and certain medications. Uncontrolled diabetes can lead to nerve damage, heart disease, kidney problems, and vision loss, making proper management essential. How to manage it. Cut down on sugary and processed foods. Refined carbs and sugary foods cause blood sugar spikes and crashes, worsening diabetes symptoms. Reduce intake of white bread, pastries, soda, fruit juices, and packaged snacks. Choose natural sweeteners like stevia or monk fruit instead of sugar. Eat fiber-rich foods. Fiber helps regulate blood sugar levels by slowing down sugar absorption. Load up on vegetables, whole grains, brown rice, quinoa, oats, and legumes, beans, lentils, chickpeas. Nuts and seeds like almonds, chia seeds, and flax seeds are also great fiber sources. Stay hydrated. Dehydration can cause blood sugar levels to rise, as the body holds on to excess glucose. Drink at least 8 glasses of water daily to help flush out excess sugar. Herbal teas and infused water, with lemon or cucumber, are great alternatives. Engage in moderate physical activity. Exercise helps improve insulin sensitivity, allowing your body to use sugar more effectively. Engage in brisk walking, cycling, swimming, or yoga for at least 30 minutes daily. Strength training with light weights or resistance bands helps build muscle, which can absorb glucose better. Even simple activities like gardening, stretching, or housework can help control blood sugar. Monitor blood sugar levels regularly. Checking blood sugar daily or as advised by your doctor helps detect changes early. Keep a record of your readings to track patterns and adjust lifestyle choices accordingly. Watch for signs of high blood sugar, fatigue, excessive thirst, frequent urination, or low blood sugar, dizziness, shaking, confusion. Take prescribed medications as directed. If your doctor prescribes insulin or oral medications, follow the recommended schedule. Never skip doses or adjust medication without consulting a healthcare provider. Maintain a healthy weight. Excess weight can worsen insulin resistance, making blood sugar harder to control. Losing even 5 to 10% of body weight can significantly improve diabetes management. Focus on portion control, balanced meals, and consistent exercise. Get enough sleep. Poor sleep can increase stress hormones, which may raise blood sugar levels. Aim for 7 to 9 hours of quality sleep per night. Create a relaxing bedtime routine, avoid caffeine before bed, and keep your room dark and quiet. Diabetes in old age doesn't have to control your life. By eating right, staying active, and monitoring blood sugar levels, you can lead a healthy, energetic life without complications. Subscribe and like now, so you don't miss any health and life advice for older adults. 4. Memory loss and dementia. Why it happens. As we age, brain function naturally slows down, leading to mild forgetfulness. However, some older adults develop more serious conditions like dementia and Alzheimer's disease, which affect memory, thinking, and daily activities. Factors like genetics, poor diet, lack of mental stimulation, and social isolation can increase the risk of cognitive decline. How to manage it. Keep your brain active. Engage in mentally stimulating activities like puzzles, crosswords, Sudoku, and chess to strengthen memory. Read books, learn new skills, or pick up a hobby like painting or playing an instrument. Lifelong learning helps create new brain connections, keeping your mind sharp. Eat a brain-healthy diet. Include omega-3 rich fish, salmon, sardines, to support brain function. Nuts, seeds, and leafy greens provide essential nutrients that boost memory. Limit processed foods, sugar, and unhealthy fats, which contribute to brain inflammation. Stay socially engaged. Loneliness and isolation can accelerate memory decline and increase the risk of depression. Spend time with friends and family, or join senior groups to stay connected. Participate in community events, volunteer work, or group activities to keep your mind engaged. Get enough sleep. Sleep helps consolidate memories and remove toxins from the brain. Aim for 7 to 9 hours per night to support cognitive function. Create a relaxing bedtime routine and avoid screens before bed. Keeping your brain active and maintaining healthy habits can help preserve memory and cognitive function. 5. Osteoporosis and bone weakness. Why it happens. As we age, bones naturally lose density and strength, making them more fragile and prone to fractures. This condition, known as osteoporosis, occurs when the body loses bone mass faster than it can replace it. Women, especially after menopause, are at higher risk due to hormonal changes, but men can also develop weak bones. Other contributing factors include poor diet, lack of exercise, smoking, excessive alcohol consumption, and vitamin deficiencies. Weak bones can lead to fractures, posture issues, and limited mobility, making prevention and management crucial. How to manage it. Consume calcium and vitamin D. Calcium is essential for bone strength and density, and vitamin D helps the body absorb calcium effectively. Include calcium-rich foods like dairy products, milk, yogurt, cheese, almonds, leafy greens, kale, spinach, and fortified foods in your diet. Vitamin D sources include egg yolks, fatty fish, salmon, mackerel, and fortified cereals. Engage in weight-bearing exercises. Walking, jogging, dancing, and climbing stairs help maintain bone density. Strength training with light weights or resistance bands strengthens muscles and supports bones. Balance exercises like Tai Chi and yoga reduce the risk of falls and fractures. Get sunlight exposure. Natural sunlight helps the body produce vitamin D, which is crucial for calcium absorption. Aim for 10 to 30 minutes of sun exposure on your skin several times a week. Morning or late afternoon is best to avoid harsh UV rays. If sunlight exposure is limited, consider a vitamin D supplement. Consult your doctor first. Avoid excessive alcohol and smoking. Alcohol interferes with calcium absorption, making bones weaker. Smoking reduces bone mass and increases the risk of fractures. Reducing or quitting these habits improves overall bone health and prevents further deterioration. Maintain a healthy weight. Being underweight increases bone loss, while excess weight puts stress on joints and bones. Eating a balanced diet with adequate protein, healthy fats, and whole grains supports overall bone health. Osteoporosis can be managed and even prevented with the right nutrition, regular exercise, and healthy lifestyle choices. 6. Depression and emotional health. Why it happens. As we age, life changes like retirement, the loss of loved ones, health challenges, and social isolation can lead to feelings of sadness, loneliness, and even depression. Many older adults experience a lack of purpose, which can worsen emotional well-being. Additionally, changes in brain chemistry, chronic pain, or certain medications may contribute to low mood, anxiety, and mental distress. Ignoring emotional health can lead to poor sleep, reduced appetite, fatigue, and even a weakened immune system, so it's important to take steps to stay emotionally balanced. How to manage it. Stay socially connected. Loneliness is a major cause of depression in seniors. Staying connected with family, friends, and community groups can improve emotional well-being. Join senior clubs, support groups, religious organizations, or volunteer work to stay engaged. Video calls, phone chats, and social media can help maintain relationships with distant loved ones. Engage in hobbies and activities that bring joy. Doing things you love can boost dopamine and serotonin, the brain's natural feel-good chemicals. Try gardening, painting, knitting, reading, listening to music, or playing an instrument. Engaging in mindful activities like meditation or journaling can help manage stress and emotions. Get daily sunlight. Sunlight is a natural mood booster because it helps the body produce vitamin D and serotonin. Aim for 15 to 30 minutes of sun exposure daily, whether through a morning walk or sitting by a sunny window. If sunlight is limited, consider light therapy lamps to help with seasonal depression. Stay physically active. Exercise releases endorphins, which reduce stress and anxiety. Activities like walking, yoga, tai chi, or dancing improve both physical and emotional health. Even simple stretching or chair exercises can boost energy levels and mood. Seek professional help if needed. Depression is not a normal part of aging. If feelings of sadness persist, talk to a doctor or therapist. Support groups and counseling can provide a safe space to share emotions and find solutions. Sometimes, medication or therapy may be needed to restore emotional balance. Maintain a healthy routine. Sleep well, aim for 7 to 9 hours per night to improve mental clarity and mood. Eat brain-healthy foods like fish, nuts, berries, and leafy greens to support mental function. Practice gratitude by focusing on positive moments each day, no matter how small. Emotional well-being is just as important as physical health. By staying connected, engaging in meaningful activities, and taking care of your mind and body, you can maintain a happy and fulfilling life. Aging doesn't have to mean sickness or suffering. By making small lifestyle changes, you can live a longer, healthier, and more fulfilling life. Which of these health tips did you find most helpful? Let us know in the comments below. And if you found this video valuable, give it a thumbs up, share it with a friend, and don't forget to subscribe for more health and life advice for older adults. Until next time, stay healthy and stay happy.